Eggs have always been at the center of numerous health debates as they have been accused of increasing cholesterol levels, thus increasing the risk of cardiovascular diseases, including heart attacks and strokes. But is it really like this, or is it just a false myth? Let's go see it. In common language, the term eggs generally refers to the unfertilized eggs of the hen, which are therefore laid without the participation of the rooster. From the preparation of sweets, such as cakes and biscuits, to the creation of savory dishes, such as frittatas and omelets, eggs are among the most used ingredients in cooking, essential in numerous recipes. With an average weight of about 50 grams, eggs are rich in high biological value proteins and monounsaturated and polyunsaturated fats, concentrated exclusively in the egg yolk. On average, it contains about 200 milligrams of cholesterol, an amount that represents 80% of the recommended daily requirement. The egg white, on the other hand, is free of cholesterol and fat, but contains a reduced amount of vitamins and minerals compared to the yolks. For many years, in fact, eggs were considered harmful to heart health, since it was known that high levels of cholesterol in the blood, especially bad cholesterol, increased the risk of cardiovascular disease. For several years, however, research has shown that most of the cholesterol in our body, about 70–80%, is produced by our organism and not by the cholesterol we consume through food. This means that although dietary cholesterol can have a certain impact, endogenous production plays a much more significant role in determining the levels of this lipid molecule in the blood. For this reason, in fact, people with high cholesterol often tend to have difficulty reducing its levels, simply by changing their eating habits. Not only that, it has also been discovered that blood cholesterol levels, and therefore endogenous production by the liver, are influenced more by the content of saturated fats and trans fats in our diet, rather than dietary cholesterol. An average egg, especially in the yolk, contains about 4 to 5 grams of fat, of which less than half are saturated fats. The remaining part is made up of unsaturated fats, such as oleic acid and alpha-linolenic acid, known for their beneficial effects on cardiovascular health. Eggs are also one of the best dietary sources of choline, a component of cell membranes, and an essential nutrient for the production of acetylcholine, a neurotransmitter responsible for nerve transmission. Eggs also contain other important nutrients, such as lutein and zeaxanthin, two natural antioxidants that help maintain healthy eyes, reducing the risk of age-related eye diseases, such as macular degeneration and cataracts. Vitamin B12, present in eggs, also plays a crucial role in maintaining brain health and the functioning of the nervous system. This is because it participates in the synthesis of myelin, a substance that surrounds and protects nerve fibers, like a sort of sheath, allowing the correct conduction of nerve impulses and amplifying their transmission speed. According to Harvard University's School of Medicine, for most people, eating an egg a day does not increase the risk of heart attack, stroke, or any other type of cardiovascular disease. However, it is important to pay attention to the foods you eat with eggs. The saturated fats found in butter, cheese, and sausages, for example, increase blood cholesterol much more than the fats found in eggs. Also pay attention to the cooking method, avoiding the use of added fats, such as butter, oil, and margarine, preferring healthier methods, such as boiling or steaming them. In conclusion, we have seen that eggs are not foods to be avoided, but can be consumed without any particular health risks if included in a healthy and balanced diet. Cholesterol remains an organic molecule necessary for the correct functioning of the body, as it performs numerous functions. In addition to contributing to the formation of cell membranes, it participates in the synthesis of some hormones, bile acids, and vitamin D.